Hi YouTube, I'm Jason Bellini and this is The Short Answer. So, heart attacks are the #1 killer in the United States, and statin drugs are the big innovation for preventing heart attacks. We actually spend as Americans over $16 billion on these drugs. The traditional prescription for reducing the risk of heart attacks and strokes is to get people's LDLs, their bad cholesterol, below a certain level, around 100. These statins are supposed to help reduce the buildup of plaque in your arteries, which can cause heart attack and strokes. New guidelines from the American Heart Association and the American College of Cardiology present a monumental shift from that strategy. Instead, they place a focus on more accurately identifying people at high risk of having a stroke or a heart attack who would now be considered candidates for cholesterol-lowering drugs. Who's considered high risk? There are 4 categories. 1, people who have cardiovascular disease. 2, patients who have an LDL cholesterol level of 190 or higher. 3, patients with type 2 diabetes who are between 40 and 75 years old. And 4, patients between the ages of 40 and 75 whose estimated 10-year risk of cardiovascular disease is 7.5% or higher. How do doctors determine your risk level? They're going to look at whether you're a smoker, they're going to look at your age, that's the most important one. They'll look at whether you have diabetes and other factors. It will likely mean more people of all ages, including younger patients, will be given statin drugs. According to Neil Stone, chair of the expert panel on the new guidelines, if young people, have very high LDL cholesterol, then those young people will get statins. But if they don't have heart disease and don't have diabetes, they likely won't reach the 7.5% thresholds. What makes these recommendations such a big deal is that they could more than double the number of Americans who qualify for statins to as many as 70 million. That's the short answer. So this is my new YouTube channel, and I hope you'll click subscribe on it. And hey, if you've got questions, put them in the comments as well. I'll try to find you the short answer.